We begin with Vipaśyanā, aligning the head, neck, shoulders, and the spine. And sitting in a comfortable posture. Slowly bring all the attention to the breath. We bring the mind into the present moment by observing the cool air enter the nose as you inhale and the warm air exit the nose as you exhale. If the mind wanders away from the breath, gently bring it back to the breath. With every exhalation, detach yourself from all the thoughts of the past, future, and the present. Now gently bring all the attention to the top of the head, the crown of the head. From this point onwards, maintain Sakshi Bhav, a witness-like attitude. Be an observer for every sensation that you experience as you move your attention through different body parts being named. Crown of the head, Sahasrara Chakra. Right brain. Left brain. Center of the brain. Bhru Madhya. Space between the eyebrows. Right side of the forehead. Right side of the head. Back of the head. Left side of the head. Left side of the forehead. Right eye and the eye socket. Go deep within, observe the four muscles of the eye. Left eye and the eye socket. Go deep within, observe the four muscles of the eye. Right nostril. Observe the cool air enter the nose as you inhale and the warm air exit the nose as you exhale. Left nostril. Observe with your breath the cool air entering the nose as you inhale and the warm air exiting the nose as you exhale. Right cheek. Right ear. Go deep within the ear canal. Left cheek. Left ear. Go deep within the ear canal. Upper lip. Lower lip. The chin. Upper jaw and the teeth. Lower jaw and the teeth. Hard palate. Soft palate. The tongue. Observe from the tip of the tongue all the way down to the base of the tongue. The food pipe. Feel it with a gulp of the saliva. The windpipe. Feel it with your breath. The kantha or Adam's apple. Front part of the neck. Right side of the neck. Back side of the neck. Left side of the neck. Right shoulder, including the ball and socket joint. Upper arm, including the bicep and the tricep. Right elbow. Right forearm. right wrist, right palm, back side of the right palm, right thumb. Observe from the base of the thumb all the way to the tip of the thumb, including the nail. Right index finger, middle finger, ring finger, little finger, left shoulder, including the ball and socket joint, upper arm of the left hand, including the biceps and the triceps, left elbow, left forearm, left wrist, left palm, back side of the left palm, left thumb. Observe from the base of the thumb all the way to the tip of the thumb, including the nail. Left index finger, middle finger, ring finger, little finger, moving towards the chest. Right lung. Observe with your breath. Take deep abdominal breaths. Left lung. Observe with deep abdominal breath. The heart. Feel the heartbeat. If you can, try and listen to the heartbeat. The diaphragm, the muscle that separates the chest and the abdomen. Observe it go downwards as you inhale and upwards as you exhale. The abdomen. Scan the abdomen from the upper abdomen down to the navel and the lower abdomen. Go deep within. Observe the different parts. The liver, the spleen, the stomach, which is below the liver, the small intestine, the large intestine, the gall bladder, and the bladder towards the end. Moving at the back, observe the upper back. Observe the shoulder blade muscles. Observe the upper spine, starting with cervical in the neck. C1, C2, C3, C4, C5, C6, C7. The thoracic spine behind the chest. D1, D2, D3, D4, D5, D6, D7, D8, D9, D10, D11, D12. Lower back muscles. Observe from the mid back all the way down to the lower back. Lower spine, starting from the lumbar spine. L1, L2, L3, L4, L5. The sacral spine. The coccyx, or the tailbone of the spine. Moving to the hip region from back to front. The gluteal muscles, gluteus minimus on the upper side, and below that, the larger muscle, gluteus maximus on the right side. On the left side, gluteus minimus, the upper muscle, gluteus maximus, the lower muscle. Coming to the base of the pelvis, perineum muscle. Moving towards the front, the genitalial area. Moving towards the right leg, the quadricep. Hamstring. Inner thigh. Outer thigh. The right knee. Backside of the right knee. The right shin bone. And the calf muscles. The right ankle. The metatarsal of the right foot. The right big toe. Observe from the base of the toe to the tip of the toe, including the nail. The second big toe. The third big toe. The fourth big toe. The little toe. The sole of the right foot. We move on to the left leg, the quadriceps, the hamstring, the inner thigh, the outer thigh, the left knee, backside of the left knee, the left shin bone, and the calf muscles, the left ankle, the metatarsal of the left foot, the left big toe. Observe from the base of the toe to the tip of the toe, including the nail. The second big toe, the third big toe, the fourth big toe, the little toe, the sole of the left foot. Now we go in the reverse, starting with the left leg, the sole of the left foot, the little toe in the reverse, from the tip of the toe, including the nail, to the base of the toe. The fourth big toe, the third big toe, the second big toe, the first big toe, the metatarsal of the left foot, the left ankle, the left shin bone, and the calves in the reverse. Backside of the left knee, the left knee, the outer thigh of the left leg, the inner thigh, the hamstrings, the quadriceps, moving towards the right leg in the reverse, sole of the right foot, right little toe in the reverse, from the tip of the toe, including the nail, to the base of the toe. The fourth big toe, the third big toe, the second big toe, the first big toe, the metatarsal of the right foot, right ankle, right shin bone, and the calf muscles. Backside of the right knee, the right knee, the outer thigh of the right leg, the inner thigh, the hamstrings, the quadriceps, moving towards the hip region in the reverse, the genitalial area, the perineum muscle at the base of the pelvis, moving backwards, the left gluteal muscles. Observe gluteus maximus, then gluteus minimus. The right gluteal muscles. Observe the gluteus maximus first, then gluteus minimus. The lower spine in the reverse, the coccyx or the tailbone, the sacral spine, the lumbar spine behind the abdomen, L5, L4, L3, L3, L2, L1. The lower back muscles from down to up till the mid back. The upper spine in the reverse. Thoracic spine behind the chest. T12, T11, T10, T9, T8, T7, T6, T5, T4, T3, T2, T1. The cervical spine. C7, C6, C5, C4, C3, C2, C1. The upper back muscles in reverse, starting from mid back upwards to the shoulder blades. Moving forward at the abdomen, will go in reverse. Observe the abdomen from the lower abdomen to the navel to the upper abdomen. Go deep within. The bladder at the base of the abdomen. The large intestine. The small intestine. The gall bladder below the liver. The stomach. The spleen. The liver. The diaphragm. Observe the diaphragm as you take deep abdominal breaths. As you inhale, the diaphragm moves downwards. As you exhale, the diaphragm moves upwards. The heart. Feel the heartbeat. Try to locate the center from where the heartbeat rises. If you can, try to listen to the heartbeat. The left lung. Feel it with deep abdominal breaths. The right lung. Feel it with deep abdominal breaths. The left hand in reverse. The little finger from the tip of the finger and the nail to the base of the finger. The ring finger. The middle finger. The index finger. The thumb. Backside of the palm. The left palm. The left wrist. The left forearm. The left elbow. The left upper arm, including the biceps and the triceps. The left shoulder, including the ball and socket joint. Moving towards the right hand in reverse. The little finger from the tip of the finger and the nail to the base of the finger. The ring finger. The middle finger. The index finger. The thumb. Backside of the palm. The right palm. The right wrist. The right forearm. The right elbow. the right upper arm, including the biceps and the triceps, the right shoulder, including the ball and socket joint, the left side of the neck, the back side of the neck, the right side of the neck, the front part of the neck, going within the contour or the Adam's apple, the windpipe. Feel it with your breath. The food pipe. Feel it with the gulp of the saliva. The tongue. Observe from the base of the tongue in the throat to the tip of the tongue at the entrance of the mouth. The lower jaw and the teeth. The soft palate. The hard palate. The upper jaw and the teeth. The chin. The lower lip. The upper lip. The left ear. Go deep within the ear canal. The left cheek. The right ear. Go deep within the ear canal. The right cheek. The left nostril. Observe with the breath from the entrance of the nostril to the turning within the nose. The right nostril, feel it with your breath. From the entrance of the nostril all the way back till the turning of the nostril. The left eye and the eye socket. Go deep within. Observe the four muscles of the eye. the right eye, and the eye socket. Go deep within. Observe the four muscles of the eye. The left side of the forehead. The left side of the head. The back side of the head. Right side of the head. The right side of the forehead. Bhru Madhya, space between the eyebrows. Going within, center of the brain. Left brain. Right brain. Crown of the head, or Sahasrara Chakra. Slowly bring the attention to the breath at the nose. Observe the cool air into the nose as you inhale, and the warm air exit the nose as you exhale. Very gently make movements in your fingers and your toes and your hands and your legs, and slowly lie down on one side and lie down on your back. Vishram Sthiti, comfortable distance between all the limbs. Hip distance or more between the legs. Hands slightly away from the hips, palms turn upwards. Relax every body part. If there's any stiffness in any body part, just gently shake that body part. Also relax the neck. You can move the head side to side. And when you're comfortable, very gently settle down with your eyes closed. Send your mind at the breath. Observe the cool air enter the nose as you inhale, and the warm air exit the nose as you exhale. Slowly move the attention to the prana, prana dharana. Observe the movement of the prana from the nose to the fingertips and toe tips as you inhale. And as you exhale, observe the movement of the prana from the fingertips and toe tips all the way out through the nose. The more still you are, the better the observation of prana. We'll slowly bring the attention to the present moment. Make gentle movements in your fingers and your toes. Feel the physical presence of yourself. And then gentle movements in your hands and the legs. And when you feel comfortable, slowly turn to the right side in Tridasana. Make a pillow with your right hand, knees slightly bent, be comfortable. Stay there, observe your breathing. Now we prepare to sit up with closed eyes. Use your hands for support and slowly inhaling, sit up in a comfortable posture, aligning the head, neck, shoulders, and the spine. Hands relaxed on the thighs in Jnana Mudra or Dhyana Mudra. Center your mind at the breath. Once again, gently join our hands at the sternum in Hridayanjali Mudra or Namaskara Mudra. Center your mind at the heart. You may maintain Sakshi Bhav or visualize your Ishta Devata with a neutral mind. Very gently, we bow down forward, extend the Namaskar Mudra to the universe, all the way forward. If possible, touch the forehead to the floor. And with the same gratitude, we inhale and rise, and then rub our palms, make it nicely warm, and we cover. Feel the warmth passing from the palms into the eyes. Inhale and gently open your eyes. Exhale, close your eyes, squeeze the eyelids gently. Inhale, open your eyes again. Exhale, blink your eyes a few times and then release your hands, taking it over the face, ears, neck, crown of the head, to the rest of the body, to the soles of the feet. And inhaling, gently open your eyes.